Okay, hello everyone. Today we're from SGD B8. We'll present you our student project with the title Prescribing Rational Antibiotics for Acute Otitis Media. Next. Okay, so these are the members of our SGD. Next. Okay, so these are the contents of today's presentation, including first epidemiology, second prescribing antibiotics, three antibiotics for acute otitis media, four etiology, five therapy guidelines, six profile, and the last one is conclusion. Next. Okay, so the first one we're going to talk about epidemiology. Hello everyone, my name is Joko Desina dari Pemayun with my last three digits numbers 165. So about epidemiology, nearly 85% of children have episodes of acute otitis media at least once in the first 3 years of life, and 50% of children have 2 or more episodes. Children who suffer from otitis media in the first year have an increased risk of chronic otitis media or recurrent otitis media. The incidence of disease tends to decrease after 6 years of age. In the United States, nearly all children by age 2 will have otitis media, and about 17% of children aged 6 months have had 3 or more episodes. The recurring episodes result in increased parental worry and anxiety, as well as medical expenses that must be borne. In developing countries, a complication that is often found is hearing loss. Therefore, giving pneumococcal vaccination is important to prevent otitis media and its complication. Next will be delivered by my friend. Thank you.
Hello, my name is Evi Esianto, and I'm going to be prescribing about antibiotics itself. So antibiotics is a drug that has physiological effects in curing that also are able to prevent the bacterial cell growth. The main goal of antibiotic therapy itself is to acquire the exact level of antibiotics in order to overstep the amount of inhibitory concentration for the pathogens. But besides the mechanism of antibiotics, which is selectively toxic, we still need to calculate the main effect, adverse effect, interaction, body reaction, resistance, and other obstacles. Next will be delivered by my friend. Thank you.
Okay, my name is Naomi Margaret Panjaitan, and I will continue the presentation. In acute otitis media, antibiotics play a role in overcoming the infection process. The use of antibiotics must be in accordance with the needs and condition of the patient. First, there is high dose of amoxicillin for children and adults who are not allergic to penicillin. And for patients that are allergic to penicillin, they are azithromycin or clarithromycin, cefdinir, cefpodosim, and cefurosin. Next. And there is high-dose amoxicillin with clavulanate for patients with symptoms that do not improve after treatment. And last, there is ceftriaxone for children that cannot be given oral antibiotics. The next.
Hello, my name is Rizky with 3-digit name 158. So the etiology of acute otitis media is infectious disease that caused by bacterial and viral infection. The most commonly found bacteria are Streptococcus pneumoniae, followed by Haemophilus influenza, Moraxella catarrhalis, group A Streptococcus, and Staphylococcus aureus, and several other microorganisms which are rarely found are Mycoplasma pneumoniae, Chlamydia pneumoniae, and Chlamydia trachomatis. Acute otitis media is often linked to viruses that cause upper respiratory tract infections such as respiratory syncytial virus, rhinovirus, adenovirus, parainfluenza, and coronavirus. The risk factor of acute otitis media is host-related or environmental factor are the key factor that affect the risk of otitis media development. The nasopharynx and eustachian tube are where this factor interact the most. The next one will be delivered by my friend. Thank you.
Hello, my name is Cassandra Tenedamara. With my last three-digit name is 152, and now I'll be explaining about the therapy guideline of the first-line antibiotics. High dosage of amoxicillin, 80 to 90 milligrams per day, is divided into 2 daily doses for 10 days. Is recommended for first-line antibiotic therapy for patients with acute otitis media because amoxicillin is effective, safe, affordable, and has a narrow microbiologic spectrum. For patients who are older than 6 years with mild to moderate disease, a 5 to 7 course is sufficient. A single dose of parenteral ceftriaxone, that is rospin, 50 milligrams per kilo, may be useful in patients with vomiting. In case of compliance, a single dose of azithromycin is safe and helpful in uncomplicated acute otitis media. That's all for my part. The next part will be delivered by my friend. Thank you.
Hello, my name is Madeline Tanilap Sapitari. With my last three-digit name is 157. Now I'm going to explain about the second line antibiotics. So for patients who are unsuccessful with amoxicillin use, the right choice for second line therapy is high-dose amoxicillin with clavulanate, not just amoxicillin alone, which given at dose of 90 milligrams per kilograms per day based on the amoxicillin component. This also can be given in patients with severe illness such as severe fever, pain, or persistent earwax after 3 until 4 days. Those who need additional protection for influenza and catarrhs beta-lactamase positive or patients with impaired immune system. But while in case of failed amoxicillin or clavulanate treatment, the patient should be treated with 3-day parenteral ceftriaxone because of its increased efficacy against antibacterial resistant as pneumonia and excellent coverage against influenza compared to other antimicrobials. That's all for me. Next will be explained by my friend. Thank you.
My name is Teman Sensoria with last digit team numbers is 15 nil. So now I will explain about pharmacokinetics of antibiotic drugs. The middle ear mucosa is the place where antibiotics will diffuse passively through the capillary membrane of the interstitial fluid. Most of the administrative mechanism of antibiotics for acute otitis media conditions are carried out orally. For example, amoxicillin with a dose of 80 until 90 milligram per kilogram per day. Amoxicillin will bind to the proteins that are controlled by chromosomal mutation. This control mechanism can cause changes in the amount and affinity of these proteins for exposure to anti-beta-lactamase drugs. After these antibiotics bind to protein receptor, there is an inhibition of the transpeptidase reaction, stopping peptidoglycan synthesis and inactivation of the cell walls. The level of antibiotics found in tissue is influenced by the physical and biochemical properties such as size, lipid solubility, binding to proteins, and cellular accumulation. So that's all from me.
Okay, for the next topic, I'm Gloria with last three-digit number 162. We'll explain about the pharmacodynamics. So for the first line antibiotics, amoxicillin, which belongs to beta-lactamase antimicrobials, it binds to penicillin binding protein 1A and generates the inhibition of transpeptidation, causing the activation of autolytic enzyme on the bacterial cell wall. Amoxicillin has half-life practically for 1 hour, the volume distribution for 20 liters, and protein binding up to 20% in the serum. The bioavailability of these antibiotics is reported 70 until 93% and could improve when taken while fasting. For the second line antibiotics, pharmacodynamic, when amoxicillin taken together with clavulanic acid, the beta-lactamase inhibitors lead to resistance to beta-lactamase. Its metabolism primarily hepatic. That's all for the pharmacodynamic. Here now is Yaninta that will explain about the next topic. Thank you.
Okay, thank you, Gloria. Hi, everyone. My name is Yaninta Ayu Ardiatidepari with my 3 last digit student number is 159. And for the first one is the drug interaction. So the synchronous admission of food and medications can unequivocally affect drug discharge, retention, dispersion, digestion, and additionally dispersal, and therefore on the adequacy and well-being of pharmacotherapy. Thus, the interactions are one of the main challenge of oral drug administration. The patient guidance may likewise show that the medication must deliberately be taken with food or drink, which really infers an instruction. This is generally never really modified ingestion or to relieve results. For instance, non-steroidal mitigating medications, for example, diclofenac or the antimicrobial amoxicillin or clavulanic corrosive, ought to be taken earlier or during a dinner to decrease the danger for gastric objection. And the next one is adverse effect and toxicity. The origination of amoxicillin or clavulanic acid has inconsistently been related with hepatotoxicity like HATEs in serum transaminases, bilirubin, and additionally basic phosphatase. This histologic discovery on liver biopsy have compromised of dominatingly cholestatic or potentially hepatocellular changes. Such effects may happen during or a little while after treatment. The hepatotoxicity is by and large reversible in spite of the fact that passing have been accounted for uncommon events, generally in patients with genuine fundamental infection or corresponding utilization of different drugs. Liver chemical irregularities have additionally been seen with the utilization of amoxicillin or ampicillin alone. As indicated by the maker, treatment with amoxicillin or clavulanic acid ought to be regulated carefully in patients with proof of hepatic brokenness. Occasional observing of liver capacity is suggested during delayed treatment. The utilization of amoxicillin or clavulanic is also contraindicated in patients with a background marked by cholestatic jaundice or hepatic brokenness related to the medication. And then, the usage of amoxicillin as an antibiotic treatment has its own side effects. For example, you may get nausea or diarrhea. Even though it's a common side effect, you may see and consult with your doctor or pharmacist if the symptoms are prolonged. Other serious side effects are severe bloody diarrhea, bruising, joint and muscle pain, jaundice, pale faces, and dark urine, skin rashes, and also purpura. Because it is a rare side effect, you are advised to seek your doctor or pharmacist after the symptoms start. And that's all from me. The next one will be explained by my friend. Thank you.
Aninta, now I will explain about the dosage of antibiotics for acute otitis media. My name is Sofia Jare Paramita, and my last 3-digit number is 156. The most common antibiotic for acute otitis media is amoxicillin with a dosage of 80 to 90 mg per kilogram per day, consumed orally for twice a day. For patients with recurrent or persistent acute otitis media, amoxicillin and clavulanate with a ratio of 90 mg of amoxicillin and 6.4 mg of clavulanate per kilogram per day is given orally for twice a day. For patients with penicillin allergy, 1 dose of Citromax is given orally daily for 20 mg per kilogram. Next slide, please. For patients with recurrent acute otitis media, Citromax 3-pack is given once a day orally at a dose of 30 mg per kilogram. For patients with urticaria or anaphylaxis to penicillin, can be given cefdinir, which given orally once or twice a day for 14 mg per kilogram per day, or cefpodoxime, which given orally daily for 30 mg per kilogram, or cefuroxime, which given orally in 2 divided doses for 30 mg per kilogram per day. Apart from antimicrobial antibiotics, there are antibiotics in the form of topical agents, like ofloxacin with dosage of 5 drops, or for patients older than 12 years old is 10 drops for twice a day. And also there are analgesics like acetaminophen with dosage of 15 mg per kilogram for every 6 hours. That is all from me. Next part will be delivered by my friend. Thank you.
Hello, my name is Felicia with 3 last digit of name 166, and I will explain about the drug administration for antibiotics for acute otitis media. So there are some variation of drug administration. The first one is for the amoxicillin antibiotics, which can be given in form of tablet, capsule, injection, syrup, or dry syrup. And then there is amoxicillin and clavulanate combined, which can be given in form of syrup or tablets. And then there is also antibiotic Citromax, which can be administered in form of tablet, injection, capsule, and suspension. And then the drug administration for cefdinir is in form of capsule and suspension, and then for cefpodoxime, which is in form of tablet and suspension, and then the next one is for cefuroxime, which can be given in form of tablet or injection, and then the next antibiotics is aflatoxin, which can be administered in form of tablet, caplet, drop, or injection, and then there is acetaminophen, which can be given in form of tablet, caplet, syrup, or drop or injection, and then the last one there is antibiotic ceftriaxone, which can be administered in form of injection. Next.
Hello everyone, my name is Frey Jonathan, with the last digit is 164. Today I'm going to continue the presentation. So for the frequency of amoxicillin, recommended treatment is given as 45 to 60 milligram per kilogram per day in 3 divided dose. If at 2 times dosing treatment is used, the higher overall daily dose of 75 until 90 milligram per kilogram per day are required. If there is concurrent purulent conjunctivitis, a history of amoxicillin treatment within the previous 30 days, relapse of a recent infection, or non-response to amoxicillin with clavulanate should be considered. And for the duration of children younger than 2 years old is 10 days, patients with chronic AOM 10 days, patients with perforated tympanic membrane also 10 days, and 2 years old children are 5 days. Next slide. Okay, this slide will be continued by reference. Thank you.
Okay, so my name is Vandika Putri Rahaindrani with my last 3-digit number is 161. For the conclusion of our student project, acute otitis media is an infectious disease caused by bacterial and viral infections in which host and environment factors are key factors affecting the risk of developing otitis media. The occurrence of acute otitis media disease is still quite common in both children and adults. The use of antibiotics is needed to overcome the infectious process in acute otitis media. In children and adults who are not allergic to penicillin, 10 days of high dose of amoxicillin might be a treatment option. High dose of amoxicillin is suggested as first-line antibiotic therapy in patients with acute otitis media. And for patients who are unsuccessful with amoxicillin use, the right choice for second-line therapy is high-dose amoxicillin with clavulanate. Amoxicillin will change the amount and affinity of proteins for exposure to anti-beta-lactamase drugs and inhibit the transpeptidase reaction, stopping peptidoglycan synthesis and inactivation of the cell walls. The usage of amoxicillin is best taken before or during meals to reduce the risk of gastric objection. Amoxicillin is well distributed in the middle ear effusion, maxillary sinus secretion, gallbladder, bile, liver, lungs, prostate, bone, muscle, and into acidic and synovial fluids, but poor permeation to the cerebrospinal fluids. Drugs for acute otitis media can be given in the form of syrups, tablets, capsules, and injection with the appropriate dosage and frequency of administration. Next. Reference that we use for our student project. Next. That's all from us. Thank you for your attention and have a nice day.